Hello and welcome back to Patient Knowledge. I'm Dr. Kirmani, and today I'm going to be talking about a common condition seen in children called febrile convulsions. Do you know that very high fever in an infant and young children can cause a fit or a seizure? They are the most common type of convulsions or fits in children. So let's get started and find out more about this. In this video, I will give you information about what are febrile convulsions, what causes them, who gets febrile convulsions, what are the symptoms, how to manage them, and how do you help prevent another episode. What are febrile convulsions? Febrile convulsions or fits are the seizures that occur in young children when they have a fever greater than 38 degrees. A convulsion or a fit is a sudden event when the child is not quite with it. It starts to jerk or twitch and may have difficulty in breathing. What causes them? They only occur when the child has a high temperature. The growing brains of the little children are more sensitive to fever than are more mature brains, and when the normal brain activity is upset, a fit can occur. The fever is caused by an infection, which is usually a viral infection and often is not obvious. A simple viral infection that would give an adult a heavy cold is the type often responsible. Sometimes an infected ear or throat or bladder may also be found by the doctor. Here I would like to mention the difference between a rigor and a febrile convulsion because often it is mistaken. So a rigor or a chill is an episode of uncontrolled shivering which lasts for 10 to 20 minutes. It may be associated with shaking and teeth chattering. A rigor is sometimes mistaken for a febrile convulsion. Who gets it? They are common and can affect any normal child. About 2 to 5% of American children before 5 years of age can have a fit from a fever. They tend to run in families. They usually occur in children from 6 months to 3 years of age and the commonest age range between 9 to 20 months. They usually stop by 6 years of age. Now, what are the symptoms? Loss of consciousness or blackout, twitching or jerking movements of arms and legs, breathing difficulty, foaming at mouth, going pale or bluish in skin color, eye rolling, so only the whites of their eyes are visible. Your child may take 10 to 15 minutes to wake up properly afterwards. Now it might be a frightening experience to see your baby throwing a fit, and you might be wondering if there are any risks involved in having a fit or a convulsion. Well, febrile convulsions, whether one or several, in normal children do not usually cause brain damage, death, or epilepsy. It does not cause any long-term problems such as any intellectual disability. Most children are absolutely normal later on. One problem is that about 25 to 50% will go on to have another seizure. Now you must be wondering when to call for help. Can it become serious or dangerous? Yes, you must look for any of these signs, and if you notice any of the things, just call for help. Convulsions that last longer than 5 minutes. Child appears to have blue lips or the child has stopped breathing. Do not wait, just call as an emergency, call the ambulance. How to manage a convulsion? It might be quite a frightening experience for the parents or carers to see their baby fitting, but there are certain things that you need to do and certain things that one should not be doing. So it's important to understand how to manage it for the safety of your baby. Place the child on his or her side, chest down, with the head turned to one side. Never lie a feeding or unconscious child on his or her back. Do not force anything into the child's mouth. The primary concern here is to keep the child's airway open. Undress the child to the singlet and underpants to keep them cool, and obtain medical help as soon as possible. Ring or go to your local doctor or to your nearest hospital. Even if the fit stops, have your child checked. Now, how to prevent another episode? Because some children have further febrile convulsions, it's important to manage any fever as soon as it is noticed. Undress the child down to singlet and underpants. Keep the child cool. Give fluids and paracetamol mixture. And remember, febrile convulsions may occur again. They usually occur from 6 months to 3 years of age. They cause no long-term problems. They do not cause death, brain damage, or epilepsy. And the good news is they stop by 6 years of age. That's all for today. I hope this information was useful in understanding everything about febrile convulsions and how to manage it. Thank you for listening. If you wish to see more of such kind of health related videos, support my channel by liking, sharing and subscribing it. Bye for now.